Hello. I hope you had a chance to enjoy the beautiful weather this weekend and also got lots of trick-or-treaters so you don't have too much candy left over. We are very anxiously awaiting the results of the FDA ruling for the 5 to 11-year-old first doses. We know that while children do not have a serious reaction necessarily unless they have underlying conditions, it's that transmission to their loved ones who may be older and have underlying conditions that is of greatest concern to all of us. And so we want to make sure that we get them access to their first dose, and obviously the more people vaccinated, the better we are. We are continuing to see an uptick in the number of boosters that we give, and so that's exciting as well. It's just important because we know as we all get closer to the holiday season, we're going to be closer together, and making sure we don't take any unnecessary risks. And that booster just gives you that extra sense that you are going to have what you need to safely get through the holidays. And of course, one more, the flu vaccine. Very, very important this year because last year we were so locked up, people's immunities are not built up the way they otherwise would have been, and so making sure that we're getting that flu vaccine early. We have flu vaccine available in all of our urgent care centers and in our retail pharmacies in Mullica Hill and Vineland. So November marks Lung Cancer Awareness Month. We are one of 100 hospitals, 100 hospitals in the country that are offering a new technology for lung screening. It's called Monarch, and Dr. Shea is doing this procedure for us out of Vineland. And it allows us to identify nodules in the lungs that may be carrying cancer earlier and also at a very microcosm of what we could have been able to do before. So we're very excited to be able to bring this to our community. We obviously are very focused on lung screening. You'll be seeing our campaigns out there talking about it and understanding the protocols, but if indeed you have any predisposition to lung disease, please make sure you reach out to our team. We're glad to enter this new realm and exciting new technology with you. So last week we had the opportunity to celebrate our first responders as well as our own facilities team, and these two groups of individuals have been so critically important as we've been battling COVID. And then this week is something that you probably don't even take note of necessarily, but it's the patient transport teams. These are the people that make sure you get to everything you need to get to within the hospital. We're so grateful for them, and they often are the smile during your day to just really help either ease that tension or give you that sense of relief as you're going back to your room. So, we're so grateful to everyone that makes your day just a little better, whether it be the first responder who brought you in or our facilities team who makes sure that you have everything you need, or especially our patient transport team. And that really, all of that was captured in our patient story this week. Joe Diamond is a father of 5, Mullica Hill resident, and a veteran, served in the Marine Corps. And Joe found himself earlier this summer impacted by COVID. And Joe says that he really doesn't remember a whole lot. It was all a blur, but he knows that those individuals saved his life. Every member of that team was fully engaged in that process. They were keeping his wife informed every step of the way. They were doing everything they needed to be able to protect him and get him back to health. And he said, the thing that's so strange is if I saw these folks on the street, I'm not even sure I would recognize them. But I'm eternally grateful that they were there when I needed them the most. Now, Joe continues to heal, and we wish him very well, but those heroes, those individuals who are working so hard every single day, really appreciate your gratitude. We know there will be a time when we are looking at our lessons learned from COVID, and hopefully the cases will just be a handful or maybe non-existent. But until that time, we'll continue to learn, we'll continue to trust the science, and we'll continue to move forward together every step of the way. Until we meet again, be well and stay safe.